Hey, thank you for joining us today. I'm Dr. Joseph Ramos. I am here with our wonderful, magnificent, I'm not just saying that, clinic director, Donielle Montoya. And Donielle runs all of our operations at FitMD. She's just so attentive to patients and all the stuff you do. I just appreciate you so much.
Oh, thank you.
You brought up to me the issue of female hormones. That's what we're going to talk about today. We haven't rehearsed this. In fact, Donielle was sitting off the set watching Dr. Hoven and I do a piece on another topic, and we just pulled her off, and so she's caught out of the blue on this about female hormones because Dr. Hoven and I, obviously two guys, are probably not the best ones to be guessing about what do you think and what do you wonder about.
Yeah.
So I'm an open book. If you listen for the next few minutes, you're going to hear something about female hormones.
Yes.
Okay, what do you want to know?
So the biggest question I get with all of my friends, most commonly, is we're at an age where, still 29, at that age where all of my friends are coming to me, ask me like, what's going on with me, right? I go and see my doctor, they tell me I'm either depressed or I need to get outside and work out. And, I feel just a certain way, but nobody seems to think my issues are real. And it's, in my gut, I'm telling them it's their hormones, but what are your thoughts on that?
No doubt about it, and I'll even break the ice a little bit to go a little deeper into what I hear from a lot of patients with the door closed, and that is they feel like they're losing their shape. Their butt takes a different shape. They feel like they're sagging a little bit in their arms, and they're like, I'm still working out, I'm still active. What's happening? You're spot on with the
belly fat. That's the big one I get all the time.
Belly fat, redistribution of fat throughout the body. Absolutely a women's hormone issue that I believe is completely unfair. Nowadays, if men are treating their low testosterone, it seems to be accepted. And not seems to be, it is. It's widespread. They're feeling good, they're feeling young and vibrant with good sexual drive, with good muscle mass, good metabolism. But women, it seems to be like, hey, call me when you're grumpy, your fat's redistributed, you're out of shape, your vagina's dry, and you're getting hot flashes so bad you don't know what to do. I mean, is that kind of what you're...
Exactly. And I think the one that breaks my heart too is when people come to me and they say, if I never have sex again, I don't care. And I'm like, wait, no.
Terrible. Yeah, exactly. Right?
Right?
So terrible. Absolutely hormone thing. Here's what makes it challenging. And I think why women were neglected in the whole hormone treatment spectrum, or why they still are. And of course, this is not how we do it at FitMD, but I think a lot of times what traditional medicine has been is wait until the tank is empty. Imagine if you were driving your car and you're going down the road and you said, I think I need gas, I'm at a quarter tank. I said, no, you're not empty yet. You'd be like, but if I'm empty, I'm gonna be in trouble. You'd stop and gas up. And with women's hormones, for years, we just waited until their tank was empty. When they absolutely were in that state of misery, then we would consider hormone replacement. Then there was a study that came out in the early 1980s, the Women's Health Initiative. And it scared a lot of females because it said there may be some propensity towards cancer with hormone replacement. So I think the combination of that study, which turned out to be completely false. And actually they took all the data from the study and re-looked at it and they said, oh no, we're absolutely off on this. Between that study and between old traditional medicine, women just have not gotten treated. There's no doubt that women should be treated with hormone replacement therapy as they're going down, not once they're at the bottom.
That's a really good comment. I just want to touch on that. So is there an age or is there a time when you think they should start? So a lot of people are like, well, once my periods start getting irregular or once the hot flashes start, is there benefit to starting before all those symptoms start?
The answer is kind of.
Okay.
And here's why it's that. Everybody should come in and be treated early. And what I mean not treated, tested early. Establish the baseline. So I love when somebody comes in and they might be in their early 30s or something. They say, I'm still having regular periods. I'm a little grumpy yet. I'm just wondering, is it my hormones? Or I'm not metabolizing fat as well. I feel like it's sticking. My exercise isn't doing anything for me. I feel like it's my hormones. I'm like, great, let's test you. Because number one, we're gonna get a great baseline. And number two, not everybody has the same hormone levels at the same age. And that's why I said the answer was kind of.
Yeah.
Some people you'll see late 40s, menstruating regularly, still exercising, same energy, same sex drive like they did when they were 20. Some people start to get it at 30. So from person to person, it's different.
Okay.
Establish a baseline. And then we look at the specific factors within those hormones, because remember that females, we always think estrogen. Females have a lot of other hormones.
Okay.
Right? Their adrenals, their ovaries, make all types of other stuff. Testosterone.
But that's a male hormone, right?
No, that's what people think. But it's absolutely a female hormone. It's a great female hormone. Progesterone, estrogens, several different types of estrogen, estriol, estradiol, estrione. These are all there. So we like to look at the balance of all these hormones. And I'm telling you what, when you identify where they're off or not in balance in our female patients, the health changes are remarkable.
So it's okay to get your blood work drawn.
Yes.
When you're not symptomatic necessarily, because then as soon as you become symptomatic and we look at those labs a second time, we're going to see the dip. And then It's a lot easier to explain the dip to somebody when we have a good baseline.
Yes, and when you see the trends, and this gets a little bit complex, but for example, estrogens a lot of times are stored in fats in our body, in the fat cells. So sometimes you'll see somebody who has a little bit higher percentage body fat, and they'll release estrogens for longer for that person because they're not storing them up as much as, say, a skinnier female would be. Sometimes you'll see some females that naturally make plenty of testosterone, and you'll see a lot of females that are completely deficient in it. And the reasons are that a lot of our foods nowadays have hormones in them. We drink a lot of stuff out of plastic bottles. There's a lot of environmental factors, heavy metals, that affect our hormones. And sometimes the area of town where you're getting your drinking water, sometimes your body composition. So that's why I like to look at the spectrum of hormones and see where they might be deficient. And as it pertains to testosterone in females, let me tell you, if you have lost sex drive, you need to have your testosterone looked at, without a doubt, for sure. Because I see it remarkably low in a lot of females. And it's life-changing when you fix it. If you have sleeping problems, and we all think we have to wait till we have hot flashes to treat it.
Right.
There's a lot of stuff before that. Sleeping problems, weight gain, lack of sex drive, vaginal dryness. That's all well before you start to get those brutal hot flashes.
I think you just explained my normal conversations with all my girlfriends. Because that's literally what people are feeling. And I think also when you were talking about testosterone, doesn't testosterone play a big role in being able to build muscle and burn fat?
Absolutely. And in fact, one of the propensities that women have with time is to get hip fractures, right? And the better muscle tone you have, and the better it goes along with helping your bone density.
Okay.
The better bone density you have decreases your risk of hip fractures. The more testosterone you have, the better metabolic activity you have, the less fat tissue you have. So there's tons of excellent literature on the effects of good core muscle strength and bone density that you're just not going to have despite your best diet and your best efforts if your hormones are off. Impossible.
Wow.
Impossible.
Sounds like you need to come to my next girls' night out.
I need to come to the next girls' night out, and we need all of you in here at FitMD to get your baseline hormones drawn. Give us a little screen. If you're not feeling anything, get your baseline drawn. If you're feeling anything, give us a screen so we can start looking and target shooting to see if there's a particular one of these many hormones I've named that are off. I'll tell you, and you've seen this in our clinic, if we can transition people where they're starting to fall, but we just kind of change that transition, they just don't even know it. They just keep living a beautiful, full life, and that's how it should be.
Yeah.
That's, equal treatment of women that men are getting right now. And we would love to treat you. If you have any questions about this, what we've talked about today, please put it in the comments below here.
Yeah.
We love getting comments. We love responding to comments. It gives us more ideas of things to talk about.
I know. This was great.
Yeah, thank you. So I appreciate you introducing me to the private girl conversations that go on
Girl club.
when the guys aren't around.
Yep, this is what we talk about.
And I'm happy to answer your questions as well and help treat you. So thank you for listening today.